Good afternoon, everyone. We have with us today Brigadier R.K. Sharma sir and Dr. Aruna Saxena for a very informative talk on male infertility. And this is a very important topic which we deal with in our infertility practice and our day-to-day gynae practice. And I requested Dr. Renu ma'am to please introduce the moderators, expert and the speakers. Over to Dr. Renu ma'am.
Good evening, everyone. The topic for today is antioxidants in male infertility. And the speaker for today is Dr. Brigadier R.K. Sharma. He is well known to DGF. He is Director and HOD, Institute of Reproductive Medicine and IVF Center, Primus Super Specialty Hospital. He is a founder director of ART Center at Army Hospital, RR Delhi, and Southern Star ART Center at Command Hospital, Pune. He was former General Secretary of IFS. He is recipient of Jagdishwari Mishra Award from Foxy and Vashisht Seva Medal Award by President of India. We have galaxy of experts today to chair the session. The first one is Dr. Jyoti Bhaskar. She is well known to all of us. She is our president of EDGF. She is principal consultant obstetrician and gynecologist at Apollo Cradle Hospital, Indrapuram, Delhi and at Delhi NCR. She is co-chairperson AOGD subcommittee of quality improvement. She is secretary Delhi chapter of Indian Menopause Society and she is executive member of NARCHI. She is member representative of RCOG North Zone. Welcome, Dr. Jyoti Bhaskar. The next expert we have is Dr. Jyoti Bali. Dr. Jyoti Bali is Director of Baby Soon Fertility and IVF Center. She is Vice President DGF Central. She is Founder Secretary of DGF Central. She is recipient of Nav Shakti Award and also APJ Abdul Kalam Appreciation Award. Welcome, Dr. Jyoti Bali. The next expert we have is Dr. Poonam Goyal. Dr. Poonam Goyal is Head of the Department IVF Max Hospital. She is Director and HOD of Obstetrics and Gynae at Panchsheel Hospital. She has edited various books and authors various books also. And she has various awards to her credit. Over to Dr. R.K. Sharma to deliberate his talk.
Thank you, ma'am. Thanks a lot. Thanks for the nice words.
Visible, sir. Visible.
Yeah, thank you, ma'am. Good afternoon, everybody. First of all, I'd like to thank Dr. Sharda Jain, madam, and also the DGA for inviting me to speak on antioxidants in male infertility. Now, as we all know, that infertility is increasing, and both husband and wife are equally almost responsible for infertility. Since a male produces sperms in millions, so any decrease in the sperm count is not that impactable as a decrease in the AMH levels or the ovarian reserve, because lady forms only one egg a month while the male ejaculates millions of sperms per ejaculate. But however, even with that low counts, the patient may have a male infertility because of various reasons. The etiology of the male infertility can be divided into, the unknown causes and unknown causes, and then some general diseases and obstruction and distribution, disturbances in the erection, ejaculation, and hypogonadism. But out of all this, if you see, the percentage, in 42% of patients, we know the cause, and we can either treat them or, we can give the answer to the patient why, the patient is not able to impregnate his wife. But in the majority of the cases, 30% of all the male factor infertility, we do not have a exact cause to tell to the patient which could be, implicated in the infertility. So today, I will be concentrating on this idiopathic infertility. We try to find out, because a lot of work is going on in this field, and to find out, to give the answer, to find the cause of idiopathic infertility. Now we know that reactive oxygen species is an important factor, from spermatogenesis, from epididymal maturation, and then capacitation, hyperactivation, and chemotaxis of the sperms towards the oocyte. So it is required, some amount of reactive oxygen species is important for reproduction, both in the male and in the female. But however, what happens, the oxygen which is being used in various metabolic reactions, it loses one of the electrons, and this causes formation of hydroxyl anions or superoxide anions, and they need one electron for the balance, because it is an unstable molecule which is there. So to make it stable, it needs one electron. So what it does is that this reactive oxygen species moves or steals the electron from other nearby biomolecules. And what are these biomolecules? These are the components of the cell, like the cell wall, the mitochondria, or the DNA. So if we have antioxidants, which we normally take in our diet, and the micronutrients which we are taking in our fruits and vegetables, so if that is sufficient, that would provide the extra electron. And if that provides an extra electron, so this ROS need not steal electron from other biological molecules, and thus does not destabilize the cell wall, the mitochondria, or the DNA. So this ROS activity, which is very essential for the sperm's capacitation, for acrosomal reaction, and for the membrane fusion, should be balanced by the antioxidants, so that you have an adequate amount of ROS, but not excess to impact the sperm functions. Now, a few words, for the general gynecologist, what do we mean by sperm capacitation? See, normally when the sperm is moving, it is moving in this, the head displacement, the lateral head displacement is around 30 degrees. But when it gets capacitated, then the head displacement is almost 180 degrees. So under the microscope, you can see the sperm which was moving earlier like this, when it gets capacitated, and then, the lateral head displacement increases. And this lateral head displacement is required to separate the granulosa cells, and for the normal fertilization or to reach the zona pellucida, the sperm has to make its way through the granulosa cells by the sperm capacitation and pushing the cells away from its way. The second thing is the acrosomal reaction. Acrosomal reaction, the zona, which is trilaminar, it has to be penetrated by the sperm. The zona would not allow the sperms to enter unless there is an acrosomal reaction. There is some chemicals, the proteolytic enzymes which are released over here, which allows to make a hole pellucida for the sperm to enter. And finally, the sperm membrane and the ulima membrane has to fuse with each other, and then only the chromosomal material of the sperm head can enter into the cytoplasm. So all these things, require some amount of reactive oxygen species over there, but if it is excess, it may get impacted. So high ROS, why it happens, I'll tell you later on, will affect the spermatogenesis. It would affect the sperm maturation in the epididymis. It will also affect the capacitation, hyperactivation, and chemotaxis, and thus will cause a male factor infertility. Normally, the antioxidants and the reactive oxygen species are in equilibration. So with the result, the normal biological activities and the morphological features of the sperms are maintained. But whenever either the ROS is increased or the antioxidants are reduced, so this affects a balance more towards the ROS, so which can affect production of these free radicals, which the body's quenching ability are not able, the antioxidants are not able to compensate. So oxidative stress plays a vital role in pathophysiology of infertility and assisted fertility. Now, how this oxidative stress occurs in the males? Nowadays, there's so many factors which are there. The pollution is, I would say now, one of the leading cause of ROS activity. The second I find is a male accessory glands infection because of the promiscuity which is going on in the society. So infection in the prostate, seminal vesicle or epididymis, is a leading cause for the increase in the ROS activity. Otherwise, smoking and lifestyle, party drugs, alcohol, and prolonged stages of spermatozoa in the epididymis. Now, you find the frequency of intercourse in the human race has reduced. A lot of studies which have come, and they found that the frequency of ejaculation in the male is reduced now, and the sperm stay in the epididymis for a longer time, and that also builds up the ROS over there. The dead, because the sperms have a lifespan of 70 days, and the dead sperms will produce an excessive amount of ROS, and all these put together will cause a protein damage and also the lipid oxidation of the sperm membrane, and the biomembrane is damaged, and also it affects the DNA of the sperm chromosomes. So with the result, there is a sperm damage and which causes the infertility. Why the sperms are so susceptible to reactive oxygen species damage? Firstly, if you see the sperm, there is hardly any cytoplasm. And since the cytoplasm is less, so the levels of quenching antioxidant enzymes are also less. So that is one factor. Secondly, the plasma membrane is rich in unsaturated fats. And these unsaturated fats get affected by the reactive oxygen species very fast. Because of that, oxidative stress mediated damage to the sperm membrane may account for the defective sperm function observed in high proportion of infertility patients. Oxidative stress also affects the fluidity of the sperm plasma membrane. So by that, clinically how you can make out is that the flagellar movement of the sperms. Now, if the flagellar movement, because the membrane is getting affected, so it becomes a little hardened. So the flagellar movement is reduced, so motility will be reduced. And it also causes effect on the integrity of the DNA. So this may accelerate the decline in the sperm count associated with the male infertility. Where all oxidative stress can act, just to recapitulate again, it can affect the sperm membrane, it can affect the sperm mitochondria, which are the powerhouses. So if the sperm mitochondria is affected, the motility will be reduced and the sperm DNA is affected. So the fertilization and the quality of the embryos and subsequently the abortions if the pregnancy occurs would be increased in these patients. Few words about inhibin B in spermatogenesis. It is a secretory product of Sertoli cells. It plays an important role in endocrine feedback, thus controlling the FSH secretion, and also has got a local role in the spermatogenesis. In obese patients where the estrogen levels are increased, and patients who are having, say, a fish from the Yamuna river which is supposed to contain high level of lead, may stimulate secretions of inhibin B, which would impact the secretions of the FSH, which would affect the Sertoli cell function. And inhibin B is increased, so the FSH is affected, and inhibin B also affects directly the spermatogenesis, and also it inhibits indirectly through the FSH secretions and the function of the Sertoli cell. So both put together will inhibit the spermatogenesis. So oxidative stress increases the inhibin B. Oxidative stress also has got a sperm cell direct damage also, and these two put together would cause infertility. And this oxidative stress leads to low quality of sperm over a period of time. It doesn't happen, within 1 week or 2 weeks. It takes when an individual migrates from an adequate to inadequate but clinical mineral status. Over a period of time, it would cause impairment, which are gradual and incremental, whether it is immunity, whether it is fertility or the normal growth. So the patient, when the minerals are in adequate amount, then slowly the values are going down because of the various reasons, the eating habits, the sleeping habits. So subclinical factors would be there, and once it goes beyond a threshold down, then we have a clinical manifestation of oligospermia or acinozoospermia or teratozoospermia, or all put together oats. So this lifestyle behavior, because of fast food and all, causes obesity and increase in the adipose cells, and also causes deficiency of various vitamins, minerals, micronutrients, and they all put together cause the hormonal imbalances, which along with the oxidative stress, which both of them perpetuate each other and affect each other and increase each other, cause the altered sperm parameters. To summarize, oxidative stress, the mechanism is either by increasing the inhibin, which causes hormonal disruption and also has got a direct effect on spermatogenesis. Oxidative stress affects second way by the cell damage and the membrane and the DNA damage. So all these things put together causes a male infertility. How do we, test for this oxidative stress, and how do we, test for the antioxidant activity? Now, this is important just for the knowledge. Oxidative stress is measured by melanodialdehyde and also by TNF-alpha. So when we measure it, these two products in oligozoospermia or acinozoospermia, normal sperm count patients, we find they are low in the normal patient, while they are higher. Both the MD and TNF-alpha are higher in the oligospermia and acinozoospermia. So that means they are the indicators of oxidative stress. So in oligospermia, there is a oxidative stress, so MD is raised, the TNF-alpha is raised, and even in acinozoospermia, these are increased. Now, we want to see what is the antioxidant activity in the semen. So that is tested by the superoxide diamidase test or by the glutathione peroxidase test. And what we find that for oligospermia and acinozoospermia, the antioxidant activity is low as tested by these molecules, while it is higher in the patients of normozoospermia. However, that trace elements may not be much different between these three group of patients. But anti-sperm antibodies have been found higher in cases of oligospermia and acinozoospermia. So that means besides testing for this, we should also test for anti-sperm antibodies if it is the case of oligospermia or acinozoospermia. But clinically, when you do the semen examination, if the anti-sperm antibodies are present, you'll find there will be a lot of agglutination. The sperm, they can be head-to-head agglutination, or they can be tail-to-tail agglutination, or they can be, head or mixed type of agglutination. So thus, the sperms are in the slide seen, in clumps together and, fix either the head or the tail or at various places. So clinically, you can see that anti-sperm antibodies are present in such patients. Now, another thing is that this membrane, they undergo oxidation, and there is a time lag, after when they are exposed to the reactive oxygen species. If the oxidative stress is more, the time lag before the initiation of LDL oxidation is decreased. So that means it gets oxidated, the membrane gets, the lipids get oxidation early whenever there is an oxidative stress. And these subfertile patients have a significantly shorter time lag than the fertile men, which indicates an imbalance oxidative stress and an antioxidant capacity. And these antioxidant preparations, when given, can significantly and persistently increase the time lag. By this, what we mean is that if for a short duration, the patient is exposed to oxidative stress for whatever reason, but if the antioxidant levels are higher, so that membranes will not get affected. And it is found that 40% of infertile patients have elevated levels of reactive oxygen species, even when the sperm count is normal. Now, this is a very important statement, because if the semen count is all right, the motility is all right, and still your IUI results are not coming, so you get worried because the female factors are normal, male factors are normal. So then you should also look for the ROS activity in the semen, and you will find it will be raised in 40% of your these patients. And when given antioxidant to these patients, the wives may become pregnant spontaneously, or your success rate with IUI will increase. Ashok Agarwal et al., they studied the levels of ROS, and they found that the ROS, when high, it's an independent marker of male factor infertility, irrespective of whether these patients have normal or abnormal semen parameters. Again, same statement, that even if it is a normal, unexplained infertility, count is normal, unexplained, you must test for the ROS activity. So they also suggested that the ROS measurement should become a part of idiopathic male factor infertility, and treatment with antioxidants may benefit these patients. There can be, various, reasons, but in most of the time, the underlying cause is the oxidative stress, whether it is production of hormones, or it is the productions of the sperms, or blockage of the sperm transport system, or erectile disorder, or the sperm parameters problem. In most of the cases, the underlying factor remains oxidative stress. So there is a need of the hour, which need to give a therapy to improve the sperm quality by decreasing the oxidative stress or countering the oxidative stress. This is a very nice paper, though it is a little earlier, 2010 paper, where, the case of, azoospermia with a FNAC confirmed maturation arrest. Now, if such a patient come to me today, maybe I will say, okay, there's a maturation arrest, you go for a donor insemination. But in this group, what they did was, they treated these patients, with this multivitamins and micronutrients and coenzyme Q10. And then another group, which are 11 in number, they were not given any medicines. Now, if you see these two slides of NSC, so you will find that there are different stages of spermatogenesis which is seen. One is spermatogonia, and two is a spermatocyte, and 3 is spermatid, and the 4th one is the spermatozoa. So this was a normal FNAC. But they chose the group of patients, which was this group, where the FNAC showed all 3 early stages, but did not show any mature sperms. So there was a maturation arrest. So if one sees all these 3, stages of spermatogenesis, so there is a hope for these patients when we give them antioxidants. So finally, there were 9 patients who were coming regularly. After every month they were coming for review, and there was a improvement in the physical properties of the semen in the treated group. The seminal parameters of the patient during 3 visits after advocating antioxidant treatment showed that, some of them, the 2 patients conceived spontaneously. Now here, all these graphs of different patients, 9 patients, which showed that from 0 sperm count, it had increased in one patient up to 30 million, and another, it increased marginally, but from azoospermia, at least, they could go for ICSI now. Similarly, the motility also improved in some of the patients to the extent that they could, impregnate their wife naturally also. And the morphology also improved over a period of time, and those who conceived have a higher improvement in the morphology of the sperms. So that indicates that patients who are having azoospermia and those who have early 3 stages of spermatogenesis, they can be given antioxidants for 3 months at least minimum, and then one can repeat the semen test, maybe monthly, or one can do after 3 months directly. And those patients who have improved in the spermatogenesis can either be given IUI or IVF or ICSI as per the count. So the patients who were untreated, they did not show any improvement as far as the count, motility or morphology is concerned. So after the first visit, they stopped coming. While the group which was treated, so they found that over a period of time, the sperm count increased from 4 million to 9.7 million. The motility improved from 0 to 16% forward motility, and the morphology improved progressively to up to 12.8 normal morphology. So to conclude was that antioxidant improves the sperm parameters qualitatively and quantitatively in patients with azoospermia with maturation arrest. But the catch here is that you should have the first 3 stages of spermatogenesis seen. So the FNAC should be seen by birth, and only when the last stage of the mature sperm is absent, in those cases, this should work. Further antioxidant intervention may be useful in treatment of these patients. Now the patients who are having oligospermia, acinospermia, and or oligoacinospermia, so study was done in Singapore, and they found the objective of the study was to explore the empirical micronutritional blends in this infertile women having idiopathic oligoacinospermia. So there were 2 groups of patients. In the one group, which was treated with vitamin C, vitamin E, B12, zinc, and carnitine, while other group was just advised lifestyle changes, but no placebo, as the placebos have vitamins, so they were not given to these patients. Only the lifestyle modification was advised to them. And what they found was that in the group 1, where this micronutrients were given, so from pre-treatment level of 15 million count, it became double, almost 32 million. While in the untreated group, it almost remained the same. Similarly, the motility also improved from 39% total motility to 60%, and the forward motility increased from 18% to 27% in the treated group, and in untreated group, it did not improve at all. So there was a significant improvement in the sperm count as well as the motility and the forward motility. The patients which are given treatment vis-a-vis the patients who are not given antioxidants. And not only that, the patients who were given treatment, they had a spontaneous pregnancy, which was 17%. And while the non-treated group, who were only advised lifestyle modification, did not have any pregnancy. So to conclude by this study, the empirical use of micronutrients in idiopathic oligoacinospermia, it appeared to improve the sperm quality as well as the quantity and aid the patient to achieving pregnancy spontaneously also. Now we all know that this all micronutrients are very costly. So should we advise these patients, instead of supplements, we can give them dietary, advices. This group, they advise the patients to increase the dietary intake of vitamins C, E, and beta carotene, as well as folate and zinc. Now, the question may arise in many of our minds, which are the foods which are rich in the zinc. So the seeds, the nuts, the dairy products, tofu, legumes, dark chocolates, meat, and egg are rich source of zinc. And zinc, has got function in many enzymatic activity. Almost 300 enzymes in a body are dependent on the zinc, and it helps in improving the immunity as well, besides improving the semen parameters. So these patients, they were given, the dietary advices, and what they found was that when these patients they took it for about 26 weeks, both the fertile and the subfertile group was given, and they found that there was a significant increase in the sperm concentration among the subfertile males. The Thade et al. In India, they did one non-randomized observation study. They collected data from 81 physicians, and they had data of almost 103 subfertile males, and they divided these patients into two groups. 42 of these patients received a product containing 18 components, including folic acid, iron, manganese, and zinc, while the second group had additionally lycopene, coenzyme Q10, vitamin E, and B complex. And that means they had a little more number of micronutrients. And what they found, that after a median 3 months of supplementation, the pregnancy issued in 25% of group 1 patient, and where extra like coenzyme Q10 and vitamin and B complex and lycopene was added, it was 46% who received this combination therapy. So that means right combination of this micronutrients is very important to achieve a higher pregnancy rate. So this controlling the ROS would help the patients who are having idiopathic male infertility, or those who are having oligoacinospermia, or those who have ROS-induced male infertility. So these patients would be benefited by giving this micronutrients. So what does the Cochrane review says about it? It recommends use of antioxidants for male infertility. To cut the story short, it also says that it increases the pregnancy rate in these couples. And not only it increases the pregnancy rate, it also increases the live birth rate in the couples, because the DNA is not damaged, so abortion rate is reduced after giving antioxidant supplement to these male patients. Because it corrects the hormone disruption, it decreases the inhibit B, it corrects the oxidative overload, and reduces the cell membrane and the DNA damage. So as far as motility count or the morphology is concerned, all these 3 parameters are enhanced by giving the antioxidants. Now there are some questions in your mind. All these micronutrients, what are they doing individually? Or if I have the problem only in the motility, which micronutrient should I give it? So if the motility is the issue, then L-carnitine, L-arginine, and coenzyme Q10 is the requirement, because that would give the energy to the mitochondria, and the function of the mitochondria is improved, so we'll have a better motility. And if the count is low, then possibly the zinc and the folic acid combination would be required to improve the count as well as the motility of these patients. And if there is an oxidative stress, then vitamin E, glutathione, and selenium is also added. So if all the parameters are affected, then combination of the L-carnitine, L-arginine, coenzyme Q10, zinc, folic acid, vitamin E, glutathione, and selenium can be given. If the patient is not able, to follow the dietary instructions, then supplements may be required because of the lifestyle things, the way the food habits are there. So the junk food does not provide all these micronutrients to these patients. What is the role of antioxidants in IUI? Should antioxidants to be given only at when the patient is for IVF, or can be given to the patients who are even planning natural or IUI pregnancy? So what they have seen is that this Duran et al. They studied the DNA fragmentation and the sperm parameters. And they found that they are the predictors for IUI outcomes, and the stability of the sperm DNA and the extent of its fragmentation and the sperm cell apoptosis determines the IUI outcome. Now, if you look at all the parameters, the concentration and before and after preparation of IUI, it remained the same. But only thing is the ROS activity, which was studied by retinal test. It was found the patients who became pregnant had lower ROS activity, 7.3, in comparison to the patients who had a higher ROS activity, which was 13.9. So that means, despite having semen parameters normal, if the ROS activity is higher, the chances of failure of IUI is higher. So we should improve that and then do the IUI for these patients. Antioxidant supplementation would improve the fertilization potential of sperm by improving the acrosomal reaction, thus helping the penetration of the sperm, and also by increasing the number of spermatozoa which are capable of fertilization. Two molecules which are also now being added. I just want to touch upon them because they are very important new molecules, and they times to come. Where we were giving only to the females, and the males also would be given this. One is the astaxanthin, which is extremely powerful antioxidant with singlet oxygen quenching capacity, which is 500 times greater than vitamin E. So that means it is much stronger than vitamin E, antioxidant activity. It stabilizes the cell membrane like a bridge and increasing its rigidity and mechanical strength. And it is also shown to inhibit inflammation. So you will find that the patients, who are showing persistently pus cells while, the cultures are coming normal, those patients, some amount of inflammation is there, in the pathway of the spermatogenesis. So there, astaxanthin would help them. And it also protects the mitochondrial function. So the motility would improve. And it is 50 times more effective than beta carotene and zeaxanthin in preventing fatty acid peroxidation of the cell wall, and also is more effective in scavenging the peroxide radicals than the beta carotene. Is better at delaying lipid peroxidation, and also is more effective scavenger of hydroxyl radicals than beta carotene. And its auto-oxidation rate is also slower than the beta carotene and zeaxanthin. So it helps increasing the pregnancy 5 times more. It decreases the inhibin B level. It decreases sperm concentration, sperm and linear velocity. It is well absorbed, well tolerated, and it has got no GI distress or other adverse reactions. So the question is, should we take astaxanthin, or there is any food from where we can get astaxanthin? It is present in the seeds of the grapes. So when we are buying the grapes, which has got seeds, because the seed of the grape has got a high concentration of astaxanthin. Don't throw away the seeds of grape. Eat the grape along with the seed. So the study which shows, they took 30 patients, male partners having more than 1 year of infertility, and 11 patients were given astaxanthin and 19 were given placebo for 3 months. And what they found was that the inhibin level in the placebo group did not decrease as much as in the cases of the astaxanthin group. And also the ROS also did not decrease in the placebo group, but it tremendously fell down from 394 to 99 in the patients who were given the astaxanthin. And also the velocity of the sperms, it also improved in patients who were given astaxanthin, and the sperm concentration also improved in the patients who were given astaxanthin. This sperm attachment with the oocytes, which was seen under the inverted microscope, and they found they were firmly attached. So the chances of fertilization was more in the patients who were having astaxanthin in comparison to the one who were not being given astaxanthin. And most importantly, the pregnancy rate in the placebo group was 10.5%, while in the treated group it was 54.5%. Pregnancy rate per month also was much higher, 3.6 in the non-treated group and 23.1% in the treated group. Now the new age problem where the male and the females are not sleeping in time, they sleep at 1 o'clock, 2 o'clock in the night, and get up at 6 o'clock and rush to the working place. They don't have 8 hours of sleep. So there is one, instead of advising them any other methods of medicines for inducing sleep. So melatonin can be given to these patients, and this is supposed to contain very high antioxidant activity, as well as it also improves the sperm quality. So the carry-home message is that lifestyle modification with dietary modifications and antioxidants are important because it increases the pregnancy rates. It also causes better live birth rate, so less abortions. And all the 3 crucial parameters of the sperm, like motility, count, and morphology, is improved after the antioxidants. And this helps to achieve the eternal blissfulness of parenthood. Thank you very much.
Thank you, Dr. Sharma, for extensively covering the topic. I request Dr. Jyoti Bhaskar to give her expert comments.
Good afternoon, everyone, and thank you, sir, for such an explicit, detailed explanation. And I think a lot of practical things also you did cover, which as gynecologists were just dealing with daily infertility also. We have really taken it out. And I love the part that you spoke about the grapes and the little seeds, that they are a very good source of astaxanthin. But yes, whenever we see a semen analysis and we see any of these particular parameters, it's very important for us to take a detailed history from the patient about his lifestyle, because there may be a history of smoking, which itself is known to reduce it significantly. There may be a past history of mumps or otitis, because as gynecologists, we do not deal much with the male and we don't go into the depth. So it's very important that we take a detailed history to find out any reason apart from oxidative stress, or which all could lead on to low parameters. And sir, I would just like to ask you, you have explained all of these particular antioxidants in detail. So if one antioxidant we need to choose, or which is a combination of antioxidants that we should be given, and for how long before we are able to see a substantial result?
See, basically, I had given the list of antioxidants, yeah. Which help improving the motility, morphology, and count. So the combination of antioxidants should be given, and it should be given at least for 3 months, because spermatogenesis takes 70 days. So just to add a little extra, so at least for 3 months you should give it. So when the patient comes for the first visit, that is the time when we start investigating them. And we already, most of the time, they will come with the semen analysis. So before the wife is being investigated further, we should start the male antioxidants immediately, so that by the time the lady is ready, so 3 months, period is over. Because otherwise, if you tell them to take later on for 3 months, they may not take it for that long. Start early.
And so what is the role of melatonin? Nowadays, melatonin is also being used in these particular patients. Does it have
melatonin has got two roles. One is that it is one of the good antioxidant. And secondly, it helps in inducing the sleep also. So with the result, these should be advised say 3 milligram of melatonin in the night, not in the daytime, because they should not drive, because otherwise, can cause accidents. So we should be very careful in telling the patient not to take melatonin in the daytime, because otherwise it can become a medical issue later on for you. We have to tell them to take it, say at 8 o'clock or 9 o'clock, so that they sleep in time and they have 8 hours of sleep. So the sleep itself, repairs many damages which are happening to the cells in the everyday life. And secondly, also it is an antioxidant also as well. So it can be given, but this melatonin as such is being produced by the gland in the night. So these patients, if they sleep, well, and if they have a deep sleep, so they would themselves would produce melatonin. So you can give it in the initial phase just to change their sleeping habits. And once they start having the normal sleeping habits, then you can withdraw the melatonin.
And so my last question, if we get a normal sperm analysis, would an antioxidant be prescribed or should we not give it?
Yeah, see, it depends. All the semen parameters are normal. And as I said, that many of these patients may have a ROS activity. And if you have the unexplained infertility, so you should do the ROS levels in the semen. And if it is increased, then definitely you should give the antioxidants to these patients, because you have now, clinical evidence of high ROS and the sperm count may be normal, but the only thing is the capacitation may not take place, or the acrosome reaction may not take place, or my next speaker is going to speak on, Dr. Aruna is going to speak on the DNA damage also. So that the sperm may perfectly look normal, and the count is normal, motility is normal, but may hide the DNA damaged chromosomes in the head. So with the result, or the acrosomal reaction may not take place. So whenever there is unexplained infertility, the male, even if the count is normal, we should do the ROS levels, and if it is increased, we should give antioxidant. That is a scientific way of treating it. But otherwise, if it may not be available everywhere, so one can give empirically also the antioxidant to the patients. It will not harm them. One. Secondly, it will also involve the husband in the treatment, because most of you must have seen, the husband is not interested in the baby and all, he's just sitting outside. So once you give him antioxidants, at least the female feels very happy. So my husband is also being given treatment. That means, and the husband also knows that he also may be the cause of infertility. Otherwise, the whole blame goes on the woman. So I always believe that we should give something to the husband always, even if all the things are normal, just to have a good, happy married life for them. We make families, we don't break families. Otherwise, infertility can break families.
Thank you so much, sir.
Thank you.
I request Dr. Jyoti Bali to give us expert comments.
I think she's not there. Madam, we cannot hear you.
Unmute, madam.
The antioxidants and male infertility is concerned, every aspect had been highlighted by Brigadier Sharma, and I think it does not leave any questions after that. I think people have to read it 2-3 times, what all he has conveyed. So with this, I think we will definitely take a second speaker on the board, Dr. Aruna Saxena.
Ma'am, एक question है, एक छोटा सा. But dose of CoQ, how much, sir? What should be the dose of CoQ?
Yeah, actually, 300 milligram is the requirement. Otherwise, giving 100 milligram is not sufficient. Yeah.
Start sharing the slide, please.
Second topic.